So, I'm here today to talk to you about predicting survival in harbor seal pups admitted for rehabilitation. So, oops, sorry, it's going too fast. How do I? There. So the first objective of my research was to examine mortality in harbor seal pups admitted at the Marine Mammal Rescue Centre. So looking to see what were the most common causes of death, if there were any trends in the timing or in the rates of mortality. And then from that, we took diagnostic data when the seals were first admitted and to see if there were any relationships in there that would then be predictive of survival until weaning. So the pups admitted for rehabilitation, we all came from the Marine Mammal Rescue Centre, so we looked at their veterinary records, and we included seal pups from June 2012 to August 2018. And you can see from this map that some of the seal pups became stranded as far north as Prince Rupert, or as far south as Sook, B.C. But from the small inset, you can see that most of them came from the area surrounding the Strait of Georgia. Most importantly, though, the seals included in this study were unweaned and estimated to be less than 14 days of age. So the diagnostic things that we looked at were recorded upon their initial physical examination. So we looked at their age, sex, the amount of lanugo present. For anybody not familiar with lanugo, basically it's just a silvery fine fur, layer of fur that is usually shed in the womb. But since lanugo pups tend to weigh less on at birth, it's been suggested that it might be an indicator of prematurity. The staff would also take their temperature, weight, length, and girth, and they would assign a body condition score. So that's basically just a score from 1 to 5, detailing the relative proportions of muscle and fat that they have. So 1 would be emaciated and 5 would be rather fat. And similarly for the study, we made an external condition score that was very similar, just to score the amount of injuries they came to us with. So with 0 being no apparent injuries, to 5 being severe trauma. We also took blood tests, and one component that we analyzed was serum biochemistry. So that just analyzes the components of the blood, or the composition, of the blood plasma, as well as hematology. And that evaluates the cellular components of the blood, so your red blood cells, white blood cells, and things like that. So basically, overall, we found 84.3% of the seals admitted to MMR survived, which is great. But what we're really interested in is that 15.7% that didn't make it. So of the ones that didn't make it, the average duration of their time in care was approximately 3 days. And 70.1% of the seals that did die did so within those first 3 days. Now, interestingly, if we look at the first week, that number jumps to 86.5%. So that indicates to us that that first week, and especially those first 3 days in rehabilitation, constitute a pretty critical period for their rehabilitation. So from all of the diagnostic factors that we looked at, of which there were 29 that did exhibit some predictive relationship with survival, we combined them to make a multivariate model to predict survival. And this model was statistically significant. It explained 51.8% of the variation in survival, and it classified pups correctly 92.9% of the time. So very good for predicting survival. And from that, we created a simpler to use scale called the NAP scale, which should be easy enough to remember because all you have to do is think about a sleeping seal like that. And so based on the most predictive factors, and so we created this. Now, the inspiration for this is a similar scale that's used to predict infant mortality or newborn mortality right after birth. So you can see that pups with a low score of those particular things had a low chance of survival. And similarly, a score of 10 would be a very good chance of survival. And so the idea is to take that complex multivariate model and turn it into a simple tool that can be used by rehabilitators to kind of assess the pup's future. So yeah, in conclusion, we found that the initial stages of rehabilitation are the most critical, that diagnostic measures taken upon admission can be predictive of survival until weaning, and that can help us to develop triage tools to better address mortality. So yeah, thanks you to the Marine Mammal Rescue Centre and the Welfare Program.
Thank you. Very nice.
Thank you.
Questions? Maybe I could ask one. Were you able to apply the model for this year's Pups to see how well you predicted things?
So I used data from 2012 to 2018, but I would like to test the final model out on the 2019 and to see how accurate it is on that data. So,
Okay, great.
Oh, there's a question there.
And could Linda come down as well? Oh, come in behind. We'll get you mic'd up. Go ahead.
Upon release, do you track this, or is there any way to track if they're surviving after release?
Not really, and I also focused on survival until weaning. So the seals are actually weaned at the rescue center, and that's because typically we see in the wild mortality is higher after weaning, but at the rescue center we see that it's highest before weaning. So we wanted to kind of look at that. That's when the majority of mortality happens at the rescue center.